Okay, good afternoon to everyone. Today we are on the 8th of June. Welcome to NORDIC Health 4.0, the Amplified Nurse, organized by Innovation Norway, Business Finland, and Business Sweden. We are on to our second session today at 4 p.m. Earlier, at 3 p.m., we have roommate presenting their solution. If you have missed it, don't worry. We have it recorded. Just email me and I can send you the YouTube link. Next, we have at 4 p.m. will be Sonitor, which is now, and at 5 p.m. later we have Hublet, which will be presenting as well. So my name is Nika. I'm from Innovation Norway, and after today, tomorrow the sessions will be 4 p.m. by Mode Sensors, which is a hydration monitoring system, and at 5 p.m. we have thermal scan, which is an early detection of breast cancer. So the presentation structure is that we have 30 minutes of presentation and demonstration, if any, followed by 15 minutes of Q&A. So just to note, presentation by companies have started since yesterday. You last until the 15th. Each day we have a few companies presenting based on the schedule. If you want, you can go to this link, and registration is free. Please share it with your friends and your colleagues. If you're unable to attend the session, please still sign up, because we can then send you the YouTube link as well. If there are any challenges that are not covered in this list of solutions that we are presenting from the Nordic companies, please email to me. We'll be on a constant lookout for you. And for any questions regarding this whole event, you can email to me. My name is Nika again from Innovation Norway. Mobile number and email is on the screen. So there is a total of 17 companies from the Nordic countries presenting. Here are the first 8. These are the remaining. So without much further ado, we welcome James Chong from Sonitor. He will be presenting today. Thank you. So I'll stop sharing. James, you can then start sharing your slides.
Sure. Thanks, Nika, for the quick introduction. Good afternoon, everyone. My name is James Chong. I'm from Grandview Kinetic, a local SME. We are representing Sonitor and Forkbeard locally, and then I'm going to be the main presenter. Okay, so this agenda that I will take all of you through. So we start with company introduction and why ultrasound for real-time location system and the indoor positioning system. And then we'll introduce 2 technologies. So the first one is Sonitor ultrasound-based real-time location system. And the second one is a Forkbeard ultrasound-based indoor positioning system. Then we'll tie these 2 technologies to hospital to home. And then we will reach the Q&A. Okay, quick company introduction. So we have been around since 2018, and we have met some of you. So a few names here appear familiar to me. So I think Caroline, and I saw YY just now. Okay, good to see you guys here. So we are a end-to-end solution provider that is based on real-time location system and indoor positioning systems. As I said earlier, we represent Sonitor and Forkbeard locally. And Sonitor is a Norwegian company based in Oslo, Norway. And it has more than 20 years of experience developing ultrasound-based products. And Forkbeard is a fully owned subsidiary of Sonitor. So I'll discuss very quickly why we use ultrasound for real-time location system and indoor positioning systems. Hospital efficiencies and workflows rely upon knowing the location of people and equipment to appropriate level in real time. And in Singapore, we have deployed some RTLS technologies that are based on Wi-Fi, passive RFID, etc., which works well in many use cases where accuracy is not that critical. For example, knowing that equipment is in a certain ward. when high accuracy is critical in areas such as busy A&E departments, a different technology is needed. Or in an outpatient department where it doesn't make sense to tag the patient. Today, so we are going to present the two technologies that can assist with these use cases and complement existing solutions within the hospitals. So why ultrasound? So as I mentioned earlier, so higher accuracy is needed for certain hospital workflows, such as in the A&E department, and it has no interference risk to lights and radio waves. So as compared to infrared-based or radio frequency-based real-time location systems. And the Sonitor systems is fully and easily scalable. So we can build virtual zones depending on needs. Okay, so in this diagram, we can see by using 4 location transmitters, we can split a ward, divide a ward using virtual ultrasound walls, making and segregating the ward into unique zones, such that we can track beds and patients within the zone, hence achieving the bay level or bed level accuracy that I mentioned earlier. So next, we're going to watch a video, last a few minutes. So bear with me while I switch.
Okay, good.
Okay.
Yeah, go ahead.
Today's healthcare environment is continuously looking for solutions that deliver efficiencies and help restrain the growth in medical cost while still delivering consistent, high-quality care. Sanford Health, a nonprofit healthcare facility with multiple locations, faced these challenges head-on in the design and implementation of their patient-centric clinic in Moorhead, Minnesota. Sanford's aim was to launch a new medical center that would accelerate access to care for patients by creating a more efficient clinic and more collaborative clinical teams to ensure patients would no longer sit in a waiting or examination room for long periods of time without a caregiver, but would instead flow through the facility quickly and efficiently. To help them achieve this, JLG Architects designed and built a facility that integrated Sonitor Technologies' unique ultrasound Sonitor Sense RTLS solutions and Intelligent Insights open healthcare software platform.
The darker blue bars are the self-rooming patients. And so what you're seeing here is they're spending more time with the nurse. Their overall cycle time or their overall treatment time is less.
To optimize and accelerate patient flow and throughput, JLG Architects designed the facility so that Sanford can easily monitor events associated with patients and staff. With the accuracy and reliability of Sonitor Sense RTLS and the automation and integration of Intelligent Insights software, Sanford can easily monitor and track patient events based on staff and patient location data. This ultimately lets them find ways to better predict workflow, improve patient satisfaction, and catch any delays in real time based on RTLS data.
Our use of tags is to help us predict workflow. It's to help add control in an area of variation. It's to let people know when the next patient is in the room. It's not guesswork. How are we going to move patients through our building in a nice, efficient, planned manner without interruptions and delays?
At Sanford, when a patient arrives at the clinic, they are given a Sonitor Sense Smart Tag. They keep this tag with them throughout their visit and are instructed to report to an assigned room so that they can self-room. This allows them to skip the waiting room entirely. As they move through the facility, their tag receives ultrasound signals from the Sonitor Sense location transmitters, which is then captured and displayed in the Intelligent Insights software. By delivering accurate indoor positioning data, time spent searching for patients can be reduced, allowing more time for patient care and other patient-focused activities. Sonitor's smart tags provide location data every 1 to 3 seconds and is displayed through the Intelligent Insights software solution so a caregiver can know exactly when a patient has arrived and is in the examination room. That information is shared via text or email to the appropriate caregiver so that they know exactly when to enter the exam room and can optimize their time and schedule. This can help move patients through the clinic more efficiently and ensure that staff is being utilized to their fullest. At the end of a patient's visit, the last staff member to attend to that individual retrieves the patient's tag. The smart tags, which are water resistant and can be sterilized, are then cleaned and canceled from the software to be reused by another patient. If the tag is not retrieved at the end of the visit, convenient drop boxes are located at the clinic's exit and patients can easily deposit them there. In addition, the clinic has tagged some of their clinical equipment. This allows Sanford to identify utilization for owned and rented equipment, improve PAR levels across the facility, and reduce costs related to keeping underutilized equipment.
When you're talking about less time for total visit time, you're talking about increased capacity, or at least the opportunity to increase your capacity without having to build additional square footage.
By optimizing patient flow and throughput, Sanford has been able to optimize facility space to ensure they are using it in the most efficient way. As a result of self-rooming, patients are no longer sitting in a waiting room, and Sanford has been able to reduce waiting room chairs from 6.2 to 2.8. Optimizing efficiency, workflow, and capacity can turn into real savings. A savings of 1 minute of a nurse's time per patient per day over the course of a day could open enough minutes of a caregiver's time to add several hundred more patient visits. That could easily translate into 1,000 hours of staff time per year. Seeing just 2 to 5 patients more per day can translate into hundreds of thousands of dollars in more revenue per year. Reducing square footage needs can deliver one-time savings that can be reinvested to help further grow the facility.
It's trying to identify what is the real value that a nurse will get, that a doctor will get, that a patient will get. What's better for them?
Combining Sonitor RTLS and Intelligent Insights software delivered significant value to Sanford by providing patients with accelerated access to care, optimizing and accelerating patient flow and throughput, optimizing and maximizing resource capacity and collaboration, optimizing and maximizing spatial capacity, and improving overall financial outcomes.
Okay, so thank you for viewing the video with us. So now we're going to present, right, the use case suitable for Sonitor RTLS, so which is in the A&E department to manage a patient flow. So I'm going to use the format that Nika requested us to provide, so which is the problem statements, because manual workflow consumes the nursing manpower. And there's a difficulty in associating patient with bed. And manual workflow sometimes can result in errors such as surgical wait time exceeded. So the solution is to deploy Sonitor high accuracy ultrasound-based RTLS. And why we are better than the competitors, such as Caddy or Stanley. So because we can provide higher accuracy real-time location, we can achieve high bay level accuracy and high certainty. So there's no need to guess the system when the system provide you with the location of the patient. So we can also automate certain workflows for the patients, such as what we have seen earlier in the video, self-grooming. So instead of waiting at the wait area, patients can go to a wait room, assigned room, and wait for the doctor to arrive. We also have battery-powered location transmitters with more than 5 years battery lives. So this is beneficial in the sense that the infrastructure requirement will be simpler with battery-powered location transmitters. So as mentioned in the video, so the same system can be expanded to track assets with high accuracy within the A&E department. Okay, so comparison with competitors. So again, so we can achieve bay level accuracy, we can achieve room level certainty, and more than 5 years battery life for a infrastructure light implementation as compared to CADI or Stanley. Okay, so reiterating, so Sonitor can be utilized in very complex areas where accuracy is extremely important. Okay, so full range of tags available. So we have tags for asset tracking, for patient tracking, and for staff usage as well. And dispensers, our system is compatible with Gojo dispensers for hand hygiene compliance. Okay, so we are running out of time, so I'm going to jump to the next technology, which is fog-beard indoor positioning systems. The core of this technology is actually the ultra beacons. They are battery powered. So it has both beacon capability for Bluetooth as well as Wi-Fi, as well as ultrasound, and it's low cost. So this can allow a healthcare institution to provide value indoor positioning or wayfinding for visitors, as well as for nurses to use. Okay, I'm going to share more. Okay, so at a high level, so it is fog-beard is using smartphones to locate itself to provide the positions based on the reception of ultrasound signals coming from the beacons. Okay, it can work with Bluetooth wristbands as well for patient tracking or contact tracing. Okay, so this is alternative to the CADI solution used at Tan Tock Seng Hospital. The next use case is for indoor wayfinding, so in the medical facilities. Okay, the advantages of fog-beard. And now we're going to do a video again, okay? Hopefully, you'll be much better than just now.
Yeah, James, okay.
Yeah, and it's the wrong one. Okay, I think I'm going to skip the video, okay? Okay, so moving on. So use case 2, our proposal is to use fog-beard to manage outpatient patient flows using the patient's personal mobile phone. So the problem statement is precious nursing resources are needed to man kiosks at polyclinics and in hospitals. And then patients could be late for appointments due to being lost in larger hospitals. So the solution is to integrate fog-beard indoor positioning into healthcare apps used by the public, such as Health Hub, Sing Health, NU Health Buddy by Sing Health, and One NUHS by NUHS. So the purpose is to enhance the app with indoor wayfinding, so you can find where you want to go easily, and automated use case possibility is to automate self-registration based on location. So instead of manipulating on a kiosk that we currently do, so when the patient arrives at the check-in location, based on the location, the patient can do self-registration on his or her mobile app. Okay, so imagine doing this on the healthcare apps. And with us knowing where the patients are, we can automate the patient flow, as we saw in the Forkbeard video, the Sonitor video earlier. So why are we better than the competitors? So the kiosk. So because we are reducing precious nursing resources that are needed to man kiosks as patients become more digital savvy. Okay, the third use case is for automated time motion analyzer with 2D path tracking. So the problem statements are, so traditional time motion analyzers needs an observer to shadow the nurse being observed. And the entry is done manually on a mobile device. So the solution is to make use of Forkbeard to develop and provide a hands-free time motion analyzer on a smartphone. So why is it better than the competitors? So because this allows a single person operation. So the Forkbeard is used to track the paths taken by the nurses. And then for the recording of the tasks undertaken by the nurse, we can make use of voice recognition. And this system enables 2D paths analysis to reduce, to be studied to reduce the daily steps taken by nurses. So to reduce fatigue so that they can provide better care to the patients. So just a quick view of the app. Okay, so here we can see the path taken by the nurse were provided by Forkbeard, and using a smartphone, we can the nurse can carry it around and provide the voice recognition ability to record tasks. Okay, so on a smartphone or even wireless earbuds. So this is the app view. On the right-hand side is the actual prototype ETMA mobile app, which we have shared with Nika as well. Okay, so so this is we have moved to the prototype stage. And for the desktop side, okay, the desktop app. So this is our idea. We are currently actively looking for a POC collaborator. So if there's any nursing team in this call or your colleagues, they are not present today, please share this idea with them. They can approach me, and then we can work out something that can meet your needs for time motion analysis. Okay. So another view for the desktop app. Okay, lastly, so use case for hospital to home. So Sonitor Sense is a tag-based real-time location system. So imagine if we configure any home to different zones, we can actually track patients' activities at home. Okay, so we can track their movement from zone to zone, and then we can create like a pattern. If the patient deviates from this pattern, an alarm can be sounded, and then we can check on them. Okay. So obviously, the tag can be used to ensure patient safety because he has a configurable emergency call button on the tags. And we can also detect that if the tag is inactive for a prolonged period, an alarm can be sounded. Okay, so this using Sonitor Sense for hospital to home. To use Forkbeard, so we can, if the patient can wear the smartphone on her, we can use that to track their activities as well. Compatibility with smartwatches is in the pipeline. So this can increase the comfort for the patient as to wear a smartwatch as opposed to hanging a smartphone on her. We can also, it's possible to work with tags, but this is in the future. Okay, likewise, we use Forkbeard to track patient activities. So in addition to higher accuracy, zone-based accuracy, or bed level accuracy Sonitor sense, we can apply fog beard to detect 2D movements of the patients at home. Okay, so likewise, so fall detection on the smartphones, on smartwatches can be activated, and the patient can also make use of, for example, voice recognition to alert caregivers or their loved ones if they are in trouble. Okay, so in summary, so we have presented two technologies. So Sonitor RTLS, use case one for patient flow management at A&E, and fog beard indoor positioning system. So we have shared two use cases. One is for outpatient journey. So when they visit hospitals or polyclinics using their personal smartphones with automation possibilities such as automated registration. And use case three is about automated time motion analyzer. So we can use that to track the workflow of nurses, and based on the 2D path data collected and the tasks recorded, analyze it to improve, okay, or benchmark against other workflows. Okay, lastly, so hospital to home can be realized by both Sonitor and fog beard, okay, as mentioned earlier. Okay, so that's all for my presentation. So I think we should have time for Q&A.
Thank you, James. Yep, so we are open up for Q&A now. You can actually unmute yourself to ask questions, or you can actually type it in the chat. Many thanks to James for his 4 use case, which are very interesting. I think these are definitely showcasing some of the limitation. I think Manfred want to ask something. Right? Hi, Manfred.
Hi, James. Can I just check for the fog beard IPS for use case 3 automated time motion analyzer, right? How you showed the map in the desktop app. Can you explain, like, you know, what's the process to do that? Do we need to like preload the map into the app, and is it, apart from the phone itself, do you need any other type of sensors?
So there are 2 ways for collecting data. So thanks, Manfred, for the question. So one is on the mobile app, and then on the desktop app is mainly used for backend management. So what I'm showing here is the mobile app. So this is what we have created already. So you can see that we can see the positioning of the iPhone. So this is the assumed nurse, and she arrived at bed B. And then using voice recognition, she has started like a turn patient process at bed B. And when she has completed turning the patient, she recorded turn patient completed. Okay, so so the voice recognition records tasks in a hands-free manner, and the fog beard allows the iPhone, right, to be tracked in its trajectory in within the covered area. Okay, so this data captured in the cloud. These 2 data are captured in the phone. In the phone, we can look at the history in this manner. Okay, the start and stop button for the app. Okay, swipe using the Apple method. And this is a backend desktop app. So with all the data collected, so we can observe the daily path, or during the recorded session, the paths taken by the nurses. And each green dot represents an activity she has recorded using voice recognition. Okay, if you click on it, you can see change drip for this instance. Okay, so and then this is just a management panel for all the nurses.
So do we need to preload the map onto the system? Because I mean, based on this,
Yes.
I mean, it will just be location, right? But then location based on what reference point?
The reference point, the map will be provided by your team, and it has to be preloaded. It has to be pre-configured. So all these things here, right? So
it needs to be calibrated, basically.
Yeah, this will be done by us. Okay, we will import the map and then digitize it, make it available for anyone who download the app. So when the app is started, this map will be downloaded to the mobile phone. Okay, and then it will be displayed, and then location will be calculated and shown on the map.
Is this using GPS?
No, this is using ultrasound. So by using...
Also, we need your sensors.
Need the beacons. So we have beacons that look like this. So this
sorry, I missed
beacons.
You need the Sonitor Ultra beacon lah.
Correct. Ultra beacons.
On its own, it wouldn't work.
No, on its own it wouldn't work. You need a reference signal as well, in addition to the reference map.
Okay, so for area like what you showed in the map, right? How many Ultra beacons do you need?
So in general, any spots in the area covered should have at least 3 beacons.
For triangulation.
Like this area, yeah, for triangulation, yes.
Okay, understand.
Yeah.
Okay, so this will work with your RTRS solution lah.
Work with the Sonitor, is it?
Yeah, the Sonitor, but it works together with the Sonitor, right?
It works together as in parallel. Okay. So it's a separate infrastructure for now. But in the future, there's a plan to converge these two infrastructure. So the infrastructure for Sonitor as well as the ultra beacons for Beard.
So for the patient falls detection on the smartwatch, basically the patient needs to install the Sonitor in their home environment, is it?
Correct. They install Sonitor or Beard in their home environment.
Beard, I mean, they have to use both lah. You have to use the Sonitor sensor and then the Beard, the app lah.
If you use sensor as in text, do you mean? When you say sensors, are you referring to like
what kind of hardware is required to track patient activity?
Sure.
For patient safety.
So if you use Sonitor, you can use wristband. So you can use this wrist text with wristbands.
Okay.
Okay, and for Beard, we can use smartwatches in place of the wristband. Okay, currently we support smartphone. I think smartphone can do fall detection as well, right?
Through using gyro lah.
Yeah, using the accelerometer gyro, yes.
But you still need a receiver, which is your
receiver is the smartphone. If you use Beard, then the receiver is the smartphone. Like here.
So can we use Beard for RTRS time motion analysis? Only use Beard or still need ultra beacon?
Can only use Beard for time motion analysis. Is that what you're saying?
Yeah.
So, the proposal is actually use Beard for time motion analysis. We can also use Sonitor for time motion analysis, but the granularity will not be so high.
Is there any
solution?
Is there any solution which doesn't require the ultra beacon?
Currently, no, because we need reference signals within the ward.
Okay, understand. So you still need a receiver lah.
You need a beacons, the transmitter.
Beacon
correct.
Okay.
Yeah, beacons.
Thank you.
Yeah, no problem. I mean, if you can shoot me an email after this call, I can send you more information. And we are open to giving you one-to-one input as well.
Can that one? I think we'll go through
Nika,
yeah.
Yeah, sure. This deck I've shared with Nika, so Nika, please feel free to share with the nurses.
Yeah, Manfred, you might miss the earlier part. No worries. This whole thing is being recorded.
Yeah.
I'll put up a YouTube channel, which I'll send out.
No problem. I think I understand how it works already. Thank you.
Okay.
Any other questions? I think just to add on, since there's no question, the 4 use case is interesting. Basically, actually, this use case was kind of brought to James when I was still with the hospital, because we do have existing RTI solution. I believe most hospitals have either Caddy or the Stanley solution, but I still face some limitation in those. So I was looking for something more accurate, and especially for A&E when patient move from P1 to P2 or different between the different areas, or even from bed to bed, it is still manually being updated into the A&E system. So that's very tedious, and you need accuracy because the bed in A&E are even closer than the wards itself. Right? And then for the automated time motion analyzer, I think this is very useful for a lot of us, especially when we want to justify or we want to find out where are all the critical bottleneck, and using human to track is quite challenging. And I think this is an automated way. So this was actually co-developed with us earlier. Yeah. So
just to add, just a quick add-on, Nika. So Manfred, just to share with you, this automated time motion analyzer that we're proposing here, right? So they need not be integrated through IHIS, any IHIS system. So it can work standalone, including the beacons. So the beacons are security compliant. So and also because they are not needed to be integrated into the hospital hardware or software. So it's standalone, and in terms of getting it do it for a small scale POC, right? It should be straightforward. We don't have to go through IHIS, and therefore much faster for us to get to where we want to, which is to help you guys do time motion analysis.
Okay, understand. Thanks.
Yeah.
Because I mean, usually we do time motion analysis. It's quite dynamic, and we kind of need to. It's not only specific located in one area. There might be a need to move the beacons to another location for another time motion analysis. So I was wondering whether this solution, let's say when it's set up, right, is it easy to shift, to move, or yeah?
I think it's easy. So I've shared this with Nika when he was still with the hospital. So I set up for him to look at it within like 30 minutes. Okay.
Because it's all battery operated, so we just stick the transducer on the wall. Yeah.
And then the mapping on this, does it take very long?
The mapping, we'll do it in advance. So if you provide the maps to us, we can do it in advance. And then when we are on site, we just attach the location transmitters, the beacons.
Okay, understand.
Yeah.
Okay, James, can you stop sharing? Let me just share my last few slides here.
Okay, thanks.
So this is my contact. So you have any questions regarding Sonitor, you can email me, or of course you can email James Chong as well, since he's local. He's a local distributor for Sonitor. And just to highlight the next session tomorrow, we have 2 companies. At 4 p.m. we have Mood Sensors, which is a hydration monitoring system. And at 5 p.m. we have Thermoscan, which is a breast cancer and detection system. So, okay, thanks everybody for joining in. So hope that I'll see you at 5 p.m. as well for the next session. See you.